I don't have to be so particular. Good morning, Dr. Pinkleton. We were
Good
with
morning.
Dr. Tressa Pinkleton today, who's on vacation. So her background is a little different. Today, we're going to talk about something that we all want to know. You want to know when you're going to feel better. How long is this going to take? What should I be expecting? Um, Phantom relapses, and what a relapse is. Before we get started here, I'm going to read my disclaimer, and then we'll get right into the interview. This interview is from our own personal experiences, and we are not talking in specifics, but in generalities about our experiences during the Coimbra protocol. We are not giving medical advice or addressing individual cases. Cases and results can vary using one method or another. Medical protocols and methods of treating MS should be done with a licensed medical professional. Dr. Tressa, good morning. I'm glad you're finally relaxing.
Thank you. Good morning.
So we're going to start in with how long the protocol is and when should I expect something?
Yeah, well, that really, like I said earlier, that really runs the gamut. I see so many people that will come into my care and then get really discouraged because within the first one or two follow-ups, which is 3 to 6 months, they're expecting 80-90% improvement or these major gains, because it happens for some, but for many it takes some time. First of all, I remind everybody that success with this protocol is defined by a cessation of symptom progression. So long as you're not getting any worse and you're also not on any of those conventional medications, that's success in my book. That's success in many other people's books, definitely Dr. Coimbra's books. So to bear that in mind, most
Can
people.
I interject something?
Mm-hmm. Yeah, of course.
It's very hard for someone to tell you that.
Yeah.
Tell you that if your disease stops, that's a victory. If you don't progress and if you get 2% back, that's a victory. It is. But it's hard when you're talking to somebody that has RMS and has gotten 95% back and can walk over and flip a light switch and go on vacation with their family. When they tell you that, you don't want to hear it. I went through that and I didn't want to hear it, but it is true. Now that I'm on the other side, shall we say, I agree.
Yeah.
I'm so happy my disease stopped. But when somebody can still walk and they tell you it's a victory, you don't want to hear that. You want to hear about the person getting out of the wheelchair, recovering.
I understand, and I sympathize with that, and I it can be a bit of a tough, I guess, conversation, but what I tell people is that the human body has an incredible ability to heal. It's very intelligent. And what we have to do is just find what's blocking that ability, remove those obstacles, and then give it time, lots and lots of patience. And, like Dr. Coimbra says, you got to give this protocol 2 to 3 years to really make a final decision about how it's going for you or not. Now, most American patients are not that patient. And so I say, please at least give it, if you've got relapse remit MS, please at least give it a year. If you have secondary progressive or primary progressive, please give it a year and a half or 2, because it takes time. There's a lot of unwinding to do when it comes to this, this diagnosis. We have to work on stress. We have to work on nutrition. We have to work on the neuroplasticity of the brain and the nervous system. And sometimes that's blocked with things like gabapentin or other medications. And there's a lot of unwinding to do. And the Coimbra protocol is anything but like a quick fix. It's a lifestyle, and it's a long-term goal, right? Now, I'll say that most of my patients will, within the first 3 or 4 months, their spasticity has decreased significantly. Their fatigue has improved significantly. Their mood tends to improve because they're feeling better in their body. And also, many of us, as we all know, are vitamin D deficient in general, and that can cause some mood issues. So that, I expect to see that with pretty much anybody when they start the protocol with me, regardless of what, part of MS they have, which, version of it. But then once that initial like 3 to 6 months happens, it really just depends on how long the person's had the disease, what are their other, health status issues. And for people that aren't really progressing in the way that I would expect, the nice thing about my training is that I'm able to then do some extra investigation. So I'll look into Epstein-Barr virus reactivation. I'll look into mold toxicity issues. I'll look into, so many people with an MS diagnosis have been worked up for Lyme, or so they think. But then you do a little extra digging and you realize all they did was a Western blot, and it had been like 10 years since their tick bite. And that is not the way to test for Lyme. And we know more in medicine now to how to be more thorough. And so I'll hook them up with something like that. And what I mean is with a more comprehensive test. And if some of those things show positive, I will either help to treat, or if it's not in my wheelhouse, for example, I'm not a Lyme specialist, I'll refer them somewhere else. Because one big thing that MS is a clinical diagnosis. There's not like one test, and there can be so many different reasons why people get this diagnosis, right? But the big thing to take away is that it's not a one size fits all. It's not everybody goes down the same path, and the success you hear from somebody or the lack of success you hear from another person does not necessarily mean you're going to experience those same things. Does that make sense?
I understand that, because everybody wants to feel better and get better. And you read all these testimonies on the Facebook Coimbra page, and, the thing you got to realize, this person has been diagnosed for 4 or 5 months. They started the protocol right away. Yeah. Their disease hasn't had the opportunity to progress. Somebody like me, I had MS 15 years before it was diagnosed. Right. I kept going to the doctor saying, something's wrong. My arm is numb. My leg is numb. My face is numb. And it was always diagnosed as something else. Exactly. And so by the time I was finally diagnosed, my disease had the opportunity to wreak havoc on my central nervous system. Well, that being said, I was friends with a lot of people that got better pretty quick. And that was hard because I wanted to get better, but it's like you said, and like we tell people all the time, we're all different. We're all going to heal differently. I mean, I know people that had MS for 30 years and are doing very well compared to me. But they had relapsing remitting. I had advanced to probably secondary progressive, and I had the disease a long time. And so it is what it is, as they say. You got to deal with what you've been dealt.
Yeah, and you do. And, again, I feel for people when they come to me and they're really immobile or having other major, symptoms, like they're having to cath or they have incontinence, and it can be really frustrating for them when they see people on the Facebook group or, on Instagram talking about, oh, I've been doing this for 6 months and like I'm doing cartwheels. I mean, that's an exaggeration, but you know what I mean? And I say, like, everybody, like I say, everybody is different. And many people, I do think, from what I've seen, many people that are on at least the Coimbra Instagram threads of success, they've been doing the protocol for years, and when I was training down in Brazil with Dr. Coimbra, I mean, I saw people that had been on the protocol for 6 years. One person had been on it for 12 years. Like it's a long process. And also, to heal, we have to have low stress. And in our culture, in the States, that's really, really difficult. I mean, on top of like, we're in the middle of the pandemic, things are kind of crazy in life in general. Our general culture is not set up for support. We don't live in multi-generational households. We have to raise our children by ourselves and care for our elderly parents by ourselves. And we work 9-to-5 jobs. And, it's a crime to take more than a week of vacation.
We don't eat right.
We don't eat very well. It's a lot of fast food. It's just, we have a completely different way of living than people down in Brazil, where you see a lot of the success stories, than people over in Germany, where there are a lot of protocol doctors. And so some of that unwinding is that I do in my office is counseling around, maybe getting out of a toxic job, maybe setting your life up for having some more support, learning how to ask for help, learning how to not eat McDonald's, even though you're really hungry and you just want something fast, because those things also slow down healing, right? And
I was just talking to somebody yesterday. They just got married. They moved into a new house. They had a new job and they were having marital issues. I'm like, just you telling me all that, I'm stressed. You got to be stressed to the core. Totally. And, they're wondering why things are happening. And I'm like, Dr. Coimbra addressed that with Yara Wanderlust very well. He's like, you got to get a grip on that. And that's what I tell everybody. Get a grip on your stress and then your body can heal. But until you get a grip on that, your body may not heal quickly.
Or it just won't. I mean, your body's going to heal. Like, even on immunosuppressants, if you give paper cut, it'll heal. It just takes a lot longer, right? And I don't, I try to make sure, like, I'm not blaming anybody. I have an incredibly high stress level these days of, I was just telling you I'm about to buy the practice I work for. I'm a very, very busy primary care physician. And my stress level routinely is an 8 to 9 out of 10. And that doesn't mean that I'm doing anything wrong. It's just how it is right now, right? And so people will often blame themselves for the state of health. And yes, we should take some personal responsibility for our health, but also just recognize that sometimes that's just how it is. And fortunately, there are practitioners out there that can help teach you how to cope with chronic stress, how to re-engage the relaxing side, the parasympathetic nervous system, the relaxing side of your nervous system, so that chronic stress doesn't deteriorate your health so quickly. There are things we can do, and it's not all just, well, you just need to relax. Like, life is not that simple. If someone told me just to relax, I'd be like, do you understand how that can sometimes be very difficult?
Yeah, I'm trying to get on my back. That goes right along with what I wanted to talk about today, which is phantom relapse. Can you address that a little bit?
Yes. Why don't you clarify what you mean by phantom relapse?
Well, I was told when I started the protocol that after a while, maybe a year or two, you'll have a phantom relapse where you think you're having a relapse, but what it is, you've stressed the body in some way. And because of that, you have it still happens to me. If I get, like, my son's a type 1 diabetic, and about 6 or 7 months ago, I was awoken in the middle of the night to screams from my wife. My son had gone low. We had to call the paramedics, and I'm yelling at them as they're coming in the door, please hurry, and that was a little bit stressful. He ended up being fine, but when I have a situation like that, my arms go numb, my back goes numb, I have numbness, but it'll go away in 24 hours. Well, people experience that sometimes and they think, oh my gosh, my disease is still active, and they work themselves up, and what it is it just, no, it's something that's there and you may have to deal with it, but you're not under stress. I don't know. Maybe you can answer this. Maybe the stress causes inflammation. I don't know. But
Yeah.
anyway, it causes a symptom, but it's not a relapse.
No. So, a relapse is where think of it like, oh, it's a bad analogy. So a relapse is when your immune system is triggered to go and start like the attack on new tissue, right? They're like, hey, we've conquered this much. Let's go attack some more nervous system, central nervous system tissue. And so you'll see new lesions and a lot of active lesions of active new fighting. And so we'll sometimes with relapses see a return of old symptoms or flare of old symptoms, but we tend to also see newer symptoms show up, right? Because new parts of the central nervous system are being attacked by our immune system. Whereas these phantom relapses, what you're calling, that's a manifestation of high stress. So when we're super, super stressed out, our cortisol spikes, the fighting side of our immune system will also start to spike, and the neural connections that we have in our brain can get a little bit mixed up if there are blockages in them from all of these scarrings, and that can cause some kind of signaling misfirings. And so people will have like these symptoms show up that they've had before, or some of their current symptoms getting a little bit worse. And it's really just the nervous system not being able to regulate itself because it's so stressed out from this high spike of cortisol. And then once we can get that stress level back down and re-engage the parasympathetic nervous system, everything kind of settles down and the wiring will start to fire properly. Another thing I'll see also on the protocol, which I thought you were referring to with the phantom relapse, is when people first get onto the protocol, or when they finally get to the amount of vitamin D for them for the protocol, which sometimes takes 3 to 6 months, sometimes takes a year or a little longer. The Dr. Coimbra will call this a heating up of old lesions. And it was, when I first heard him talk about it, it was, I don't know, it just made me smile because he's like, there's no real way to describe this. We don't really know what this is, but in naturopathic medicine, we know what this is and we talk about it all the time. Where when the body finally gets into healing mode, you can have a worsening of old symptoms, a return of old symptoms or a worsening of current symptoms. And conventional medical philosophy does not really have a way of explaining it. But in naturopathic medicine, we talk about healing discharge or a healing crisis. And I hate those phrases because it makes things sound bad when it's really a good thing. But it's almost, I describe it like the immune system will kind of switch, and those little fighting parts of the immune system will kind of come out of those lesions, and then the healing side of the immune system will start to take inventory and go, oh my God, look at all this damage we've been doing. Like, this is not good, guys. We gotta start fixing this. And just because there's that activity, just that like switching of tasks in the central nervous system, people will feel that in their body because there's stuff going on in their brain. So they're going to feel it in their, hands, or they're going to feel it in their muscles, and people will freak out. They'll go, oh my God, all of these, I just started the protocol and all of a sudden my neuropathy is worse, or like my foot drop got a little worse. Like, oh my God, what's going on? And I go, no. This is a good thing. Write it out. It'll be over in like 2-3 weeks tops. It's just your immune system kind of taking inventory of what it's been doing and realizing that it's got to change its tune. And people will come out of that and they'll actually, most of the time, have some gains, have some improvement in those symptoms that were kind of flared. When they come out of that healing crisis, they've regained some either movement or sensation or what have you. And that's a cool thing to witness and to be able to explain to people, because like I said, conventional medicine just does not have a way of talking about it, but it's talked about all the time in my field. And so those are two different types of phantom relapses, I guess we could call them.
Something that I'm dealing with a lot with people, and it's hard for me to deal with, even though I've been through it, was they get it 9, 10, 11, 12, 13, 14 months, and they see a symptom they haven't seen before.
Mhm.
And I have to tell them in layman's terms, because I don't know exactly what to tell them, but if I'm wrong, you can disagree with me or you can tell me, correct me. Um, your disease is not progressing. Something has caused you to, inflammation in this area or something has caused a symptom to rear its head. Maybe you've never had before, but it's hard to say, even though you haven't had the symptom, it's not new. You're not progressing. It happened to me to where I knew I was getting better. And then, I had a day or two of just couldn't lift my head off my chest. And, then you start thinking, okay, it's not working for me. And I have to tell people, no, it's working. I know it's working because of what you told me and what you've experienced, but you've got to go through this and you've got to wait it out. And it's hard for me to tell that to people, but I have yet to see anybody that I've counseled go through that and then eventually get through it. I mean, I had one woman start crying and she's as tough as nails. And she was talking to me in the 9th month and she just couldn't take it. She just started crying and she felt terrible and she, was having some symptoms. And you talk to her now, you'd never know it,
Yeah.
but we had to get through that. And I was glad to be there for her because, like I said, she's tough as nails. And I knew that if she was crying, that she was struggling.
Yeah. Well, the stress can also get people, especially with this diagnosis, it's really stressful and it can be scary. Now, I would disagree a little bit with what you said because when people get on the protocol and we get them to that right amount of vitamin D, I don't tend to see new symptoms show up. And if I did, I would encourage them to go get an MRI. And Dr. Coimbra in my training did say some people are going to have small little relapses while you're onboarding them because until they get to that amount of vitamin D that causes this disease suppression, they have the potential for relapse. And that's one of the reasons why we counsel so strongly in the beginning to get stress down because there's less of a chance of relapse when we are, relaxed. I will say that there are some cases where people, they've been on the protocol for a while, they've been doing really well, and then all of a sudden something new will happen and I'll tell them, go get an MRI. Everything's fine. It does not look like they're having a relapse. And that always triggers me to look at some of those other issues, like have we been letting a reactivated Epstein-Barr virus just go, do its thing this whole time? Maybe we need to look into that. Maybe we need to look into mold issues or heavy metal or what have you, other things that can cause chronic disease and autoimmune disease. And 9 times out of 10, I'm able to uncover something and, target that through treatment. And then that new thing will go away. So that's another thing to keep in mind. Because I
totally agree with you. One of the things I should have said there when I was saying all that is your disease is active until it stops. We don't know if that's 5 months or 1 year or 2 years.
Or 3 years. And another thing too, I'll remind people that other things can cause other symptoms, like I have now 2 patients where, they've been doing the protocol, but they keep having this one type of back. One person has some back pain and the other person has this arm pain and other symptoms. And that just, those things were never getting better. And finally I was like, I don't think that this is MS. I really think that there's some other issues here because structural things can cause a lot of MS symptoms like paresthesia, like neuropathy, like muscle spasming, weakness. And lo and behold, both of those 2 individuals have some structural, issues. One person has some stenosis, another person I think it was just a really bad herniated disc. And so reminding them that when they're symptomatic, that's not necessarily MS. It's just, a different a different issue. That can be, in the beginning, it can be difficult to parse that out because everything feels like the same thing. But it's important to remember, just because you have an MS diagnosis doesn't mean you can't also just have other issues with your body, right?
Right. I mean, I'm real big on healing the gut and getting your body's going to have its best advantage of healing if you're strong physically and you've healed the gut, you've healed your body, then you're going to give your body the opportunity it needs to heal better. I think when I started, I saw results in 41 days. Then probably at 6 or 8 months, it got really bad again. I think the reason I responded so well is I had a really good diet. And then I went off, and I'm not sure why, but I got worse, and my eating wasn't as good. And I sometimes look back and think, maybe if I'd continued, my diet or eating right, that I may have healed better, but I don't know. I don't cry over spilled milk. I did.
Yeah. But it's important to know that, like, when we have, sorry, the sun just keeps going in and out over here. When we have a chronic diagnosis, bringing inflammation down as much as possible it's a really good way to go. And I've had some patients that have been on the protocol feeling better, and then they've reintroduced some previously removed foods, and 6 months later they're complaining about some old symptom returning, and they're getting nervous about it. And so then I'll say, like, haven't you been eating gluten for this whole year again? Maybe we should take that out, because you totally reacted to that 2 years ago. So let's try that. And then they will, and then they'll start feeling better again. And so, that ties back into that story you told when your son was having that urgent event. It's stress, when we're eating food intolerances, or honestly, foods that just aren't really food, like fast food or what have you, that can, if it's bothering our gut, that will put stress on the body, which will then cause other.
Yeah, your picture locked up. I don't know what's going on. Are you there? All right. You there?
I'm there. Where'd I cut out?
We'll link all this back up. So I don't remember where you're at, to be honest with you.
That's okay. Yeah, where'd you lose me?
You had addressed my son, and you were talking about stress upon the body, and
yeah. So what I was saying was, so just like when you were in that stressful event and your symptoms flared because of stress and cortisol are being released, the same thing happens when we eat foods that are inappropriate for our bodies. And some foods can be inappropriate for one person and totally appropriate for another. So I'm not of the mindset that gluten is just bad for everybody. Some people can tolerate it, some people cannot. But when we eat those foods that are causing inflammation and stress on our body, it can turn the volume up on our symptoms. And so learning how to figure that out, and I do some of that work with some patients if they want that, really can help those symptoms to reverse or getting worse more quickly.
well, I think we've covered just about everything. I just want to say to everybody, I know how it is. When you get sick, you want to get better. But in our culture, this is something you got to realize. We stand in front of a microwave, and if you don't do this, you're a liar. We stand in front of a microwave and say, hurry up, hurry up, hurry up, hurry up. We're used to instant gratification. Yeah. And we all have heard the old adage, good things come to those that wait. That's what happens with the protocol. If you wait and you give your body everything it needs. It'll heal itself, but you got to give it time. And we don't know what you're going to get back. You can get back, as Dr. Damas has said, you can get back 2% or 95%. Both are victory, because in medical school, they teach you that you don't get anything back. And I can testify, I've gotten things back, but you've got to be patient. You've got to give it time. And for most, it's going to be over a year. For myself personally, it was 2.5 years, but I was more advanced. So that's my 2 cents, as they say in the United States. Well, thank you, Dr. Tressa.